All right, welcome back to UWorld's Next Gen NCLEX Review. I'm Professor Brittany, a nurse educator and content creator here at UWorld. We hope you guys will share this session right now so we can help as many nursing students as possible. So this is what today is going to look like. We're going to be doing one of our question drill sets, and we're going to focus on oncology. We're going to go through them with a quick cadence. And so I will read them. You will have 30 seconds to answer. I will show you the right answer and give you some quick tips on why the correct answer is right. The purpose of today will be more focused on practice and less more than a deep dive into content. So as always, drop your comments in the chat, engage with us. Our content expert, Miss Nurse Samantha, is monitoring and will be here to answer any questions. I apologize if I get excited and I speak too fast. Let me know to slow down, and we will be posting the recording on all social media platforms. All right, let's do this. The nurse is caring for assigned clients. The nurse should first assess the option 1, acute myeloid leukemia, is receiving chemotherapy and is reporting alopecia and anorexia. Option 2, esophageal cancer, is receiving external radiation therapy and has warm red skin on the neck. Option 3, aplastic anemia, is scheduled to receive 2 units of packed red blood cells and is reporting fatigue and pallor. Option 4, Hodgkin lymphoma, is scheduled to receive chemotherapy and has distended neck veins. 30 seconds. Go ahead and drop those answers into the comment box below. Make sure to share and tell a friend to tell a friend. Show us some love and follow for more. Hello to Nurse Oncology at the SNAP conference and everyone there. In honor, where are all of you from? I have traveled for 13 years and would love to know. I want to give some honorable mentions to Omaha, Houston, Detroit, New York, Michigan, Niger, India. Are you with us here? I am a Texas girl, but by way of Oklahoma. Boomer Sooner, we're one. All righty. Before we break this down, drop in the chat why you think this intervention was prioritized in this scenario and which part of the question stem gave you a clue to the correct answer. We would love to hear from you. So the word first is a clue that this is a priority question. So I need to pull those priority strategies out of my test-taking toolbox. Airway, breathing, and circulation. And this is always in order of how fast the body's systems decompensate. Therefore, medical emergencies are always going to take priority over ABCs. So assess is also the clue that we'll need to determine if the clients are stable or unstable and if the findings are expected or unexpected. So in option 4, that is correct because the superior vena cava syndrome is an oncological emergency that occurs when an obstruction like a tumor is compressing on the superior vena cava, and that prevents blood flow from blood flow back to the heart from our upper region like our head and neck area. Findings like distended neck veins or facial edema or any upper body edema associated and accompanied by dyspnea are findings associated with superior vena cava syndrome. Without intervention, this can be life-threatening. Okay, so can we see how pathophysiology influenced our choice here? All right, remember, unexpected findings require further diagnosis and planning. Now, options 1 to 3 are expected findings for the scenario. Alopecia, the hair follicles become damaged, and then anorexia, nausea, vomiting, bowel problems, constipation, diarrhea, and then that inflamed esophagus and suppressed appetite. Those are all common adverse effects of chemotherapy, which is a cytotoxic drug that eliminates normal tissue in addition to cytotoxic tissue, and it's not selective of the target. The warm red skin, that's a common side effect of external radiation therapy. There's a huge megavolt machine, and it directs radiation from the outside of the body to target internal tissues, and that's what's causing that redness, and it can last for 1 to 24 hours. And in this case, the neck was the external site, and it was used to target the esophagus. Now, fatigue and pallor is an expected finding for anemia, and this means that there are decreased red blood cells, and we know that red blood cells are responsible for carrying oxygen, and the pallor comes from the low hemoglobin levels and reduced blood flow to the skin. So awesome job. All righty, next question. NCLEX passers, let us know what study tips or strategies that have worked well for you and what you would like for us to share with others. And then go to uworldnursing.com to share testimonials. And then when you do tests, check out our video on predicting NCLEX success. All right, so the nurse is observing a staff member administer medications via a gastrostomy tube to a client with esophageal cancer. The nurse should intervene if the staff member is observed. Option 1, flushing the gastrostomy tube with water before and after administering medications. Option 2, placing the client in a semi-Fowler position prior to administering medications. Option 3, instilling a carbonated beverage to dissolve an obstruction in the tube. And option 4, clarifying the prescription for an extended release medication. All right, 30 seconds. Let us know what studies, tips, or strategies have worked well for you that you like to share with others in the chat. All righty. Now, intervene here means the action is not safe and there will be a complication if that action is performed. So essentially, a G-tube is a tube that goes directly into the stomach so that part of our upper GI tract is skipped. In clients with esophageal cancer, a lot of times that route to our stomach is going to be obstructed or impaired. Now, that could be caused by a tumor or even radiation. So that G-tube placement is a common intervention in these clients. Now, option 3 is not safe. We can give feeds and meds through a G-tube. In terms of what the question is asking, carbonated, sugary, or acidic liquids can worsen the blockage and then break down the tube, so we will need to intervene if we see that. We can flush these clogged tubes with warm water using like a back and forth motion. And if that doesn't work, we can use pancreatic enzymes to declog it, or there are mechanical devices available for declogging feeding tubes. Now, all the other options are interventions that should be employed. So drop those rationales in the chat below. We always flush a feeding tube in adults with 30 cc's of warm tap water every 4 hours during continuous feedings or even before and after each bolus feeding. We always use sterile water in immunocompromised patients or even critically ill patients, and we flush the tubes between medication administration. We know that proper patient positioning is key to prevent aspiration. So we always keep the head of the bed elevated 30 to 45 degrees, and if they can't tolerate that, we can do a reverse Trendelenburg position. Now, if we are doing bolus feedings, we want to make sure that the head of the bed stay elevated for 30 to 60 minutes to prevent aspiration after feedings. And we never, ever crush extended release medications. It is not safe. Those medications are designed to deliver a steady state of drug over an extended time, much like giving an IV infusion to a patient. So that would be a huge safety concern. Awesome job. I know you all did so well. Okay, moving on. The nurse is caring for a client who requires neutropenic precautions. Which of the following actions should the nurse take? Select all that apply. All right, option 1, administer the intranasal influenza vaccine to the client. Option 2, place a surgical mask on the client during transport. Option 3, remove fresh flowers from the client's room. Option 4, instruct the client to bathe daily. And then option 5 is assign the client to a private room. All right, 30 seconds. Drop those answers in the chat. Make sure you check out uworldnursing.com and let us know what content areas you would like for us to drill next. Pharmacology, med-surg, pediatrics. We love to hear from you, and we always take those things into consideration. All righty. Awesome job. This is a select all that apply. So we will choose all interventions and options that apply to this scenario. So we'll take a true and false approach to each option. We want to look for interventions in this case that are safe and appropriate for the client, and always think, how does pathophysiology relate? So bone marrow suppression or myelosuppression is an adverse effect of systemic chemotherapy. And that leads to a decreased production of bone marrow components. So always think decreased red blood cells, white blood cells, and platelets. And that causes a risk of poor perfusion, infection, and bleeding. Now, decreased circulating white blood cells is otherwise known as neutropenia. So clients with neutropenia are more likely to get infections because the neutrophils, which is the type of white blood cell, are important for fighting off germs. Now, neutropenic precautions are typically implemented when the client's absolute neutrophil count is less than 1. Looking at options 2 through 5, these are appropriate infection prevention measures, And then why? Drop your rationales in the chat below. And let's look at option 2. You always teach patients and caregivers to avoid crowds and people with the cold or flu or any type of infection. If they're in a public area, they should always wear a mask and use hand sanitizer frequently. Now, option 3. Avoid prolonged contact with soil, such as gardening and household renovations, fresh flowers, uncooked meats or seafood, eggs, unwashed fruits and vegetables. And they should always ask their primary healthcare provider about any specific diet guidelines. Option 4, the skin is the first line of defense from bacteria. And they should bathe or shower daily and use a moisturizer to prevent the skin from drying out or even cracking. And then option 5, they should have a private room and a HEPA filter so they can remove any airborne germs, especially for those with long-term neutropenia, and compromised clients should be kept away from those with infections like respiratory illnesses. And then option 1, as we see, is false. And go ahead and drop that in the chat. And remember, we do not administer live vaccines to immunocompromised clients. The intranasal flu vaccine is a live attenuated vaccine, meaning it contains a weakened form of the virus. It can't cause disease in a healthy individual, but it still stimulates an immune response to protect against future infections. And we never give it to immunocompromised clients or pregnant women. Good job, you all. Awesome job. All right, moving on. The nurse is teaching a client who had radioactive iodine therapy 1 hour ago. Which of the following statements by the client would require follow-up? Option 1, I should avoid contact with my 3-year-old child. Option 2, I should flush the toilet 2 to 3 times after each use. Option 3, I will ask my spouse to disinfect our shared bathroom daily. Option 4, I will wash my clothing separately from my family's clothing. All right, 30 seconds. You all are doing amazing. Thank you for joining us. And make sure to check us out Tuesday for live lectures and then Wednesday and Thursday for question drills. And if you miss it, no worries. We make sure we post everything on all social media platforms. We will be taking a break for the holidays, so make sure you check out our uworldnursing.com event page to stay up to date. All righty. Awesome job. So remember, for patient teaching questions, prioritize safety, prevention, or risk, and always avoid options with medical jargon. Assess patient readiness before teaching, and consider if Maslow's hierarchy of needs or the ABCs will apply. And you always want to make sure that the teaching is relevant to the client's condition. So requires follow-up. It means that the statement is not safe for the client or it indicates incorrect understanding. So we can take the true-false approach here and eliminate any option that is true. So option 3 is false. And radioactive iodine, it treats hyperthyroidism by damaging or destroying the thyroid tissue, and that will decrease the amount of thyroid hormone that is circulating in the bloodstream. After treatment, the client will emit that radiation through body fluids like saliva or urine for up to 1 week, and that will also be dependent upon the dose that was administered. Now, the client received the radiation 1 hour ago, so it would not be safe for the client's spouse to be around bodily fluids. So that statement would require follow-up, and the nurse should teach the client safety precautions to protect others from radiation exposure. All the other options are true statements, and they require knowledge of safety implications and patient teaching for radioactive iodine therapy. Awesome job. All right, moving on. The nurse is teaching a client who is receiving external radiation therapy about skincare. Which of the following information should the nurse include in the teaching? Select all that apply. Option 1, alternate application of cold and hot packs to the affected area to manage discomfort. Option 2, wear a wide-brimmed hat and long-sleeve clothing when spending time outdoors. Option 3, apply lotion recommended by your healthcare provider to the affected area. Option 4, keep the affected area covered with a compression garment. Option 5, exfoliate the affected area with a washcloth while bathing. All right, 30 seconds. You got this. Please let us know if there are any clinical situations you would like for us to explore in future sessions. Drop that in the chat, and we love to cater to your needs and help you in any way that we can. So please let us know. A little bit longer. This is kind of a longer question. Good job. I know you're doing well. All righty. Awesome job. So this is a select all that apply. So again, we're going to choose all the interventions that are applicable. We take the true false approach for each option, and we're going to look for statements that are safe and appropriate for the condition this time. Think about how patho relates. Go ahead and drop that patho in the chat box that we discussed earlier. Remember, external beam radiation is the most common form of radiation therapy, and it's used to treat a number of malignancies. So that megavolt beam is being passed through that external tissue to reach an internal target. The skin in the treatment field can be red for 1 to 24 hours. It could be weeping of serous fluid, and our goal is to prevent infection, maintain that skin integrity, and then promote healing. Now, options 2 and 3 are true, and why? Well, essentially, the skin is already being damaged due to being exposed to those strong radiation beams. So we don't want to worsen or exacerbate any existing damage. And when you talk about radiation therapy and skin care, you should always teach the patients about how to protect their skin from the sun. So wearing a wide-brimmed hat and long sleeves will do just that. Also, when it comes to lotion, you want something that is approved for the client. Mild, unscented lotions without any heavy metals or alcohol, perfume, or additives is key, because all of these things will help maintain the skin integrity, prevent infection, and promote wound healing. Now, looking at options 1, 4, and 5, they're incorrect. And why? Well, we never use heating pads or ice packs or hot water bottles in the treatment field because bacteria will have a party in the field. And that can cause an infection and prevent healing. Constricting garments or even exfoliating or rubbing the skin, it will actually traumatize that skin that has been exposed to that megavolt radiation beam. Awesome job, you guys. Moving right along. The nurse has been advised that a client with tumor lysis syndrome has hyperkalemia. It would be a priority for the nurse to, option 1, administer IV potassium chloride. Option 2, initiate continuous cardiac monitoring. Option 3, prepare the client for hemodialysis. Option 4, monitor the client's serum glucose level frequently. 30 seconds. You got this. Remember, you are kind, you are smart, you are important, you are capable, and you're ready for this question. The quiz, the exam, NCLEX, whatever you have coming up, okay? Also, make sure you take advantage of our study now and pay later with the firm for as low as $13 a month. Trust me, I get it. If you need it, use it. Top ramen and peanut butter and jelly souffle sandwiches were my friend in nursing school. All righty. Awesome job. Remember, priority means most important. So we always think about the ABCs. So we want to look for the intervention that is safe, life-saving, and will give you that desired outcome. The first step in that nursing process is assessment or recognition of abnormal cues. So we always assess before intervening, and we think about how does patho relate. So let us know what you're thinking in the chat. Drop your rationales in the chat box. Let us see your clinical judgment. Don't be shy. All right, so tumor lysis syndrome is an oncologic emergency, and it happens when cancer treatment is successfully destroying the cancer cells. That results in a release of intracellular components, potassium, phosphate, DNA, RNA, and it is metabolized to uric acid by the liver. Clients with tumor lysis syndrome can develop significant imbalances in all of their serum electrolytes, and typically we'll see hyperkalemia, hypocalcemia, hyperphosphatemia, and hyperuricemia. These are all hallmark signs of tumor lysis syndrome. These things can also be accompanied by weakness, muscle cramps, diarrhea, nausea, vomiting, seizures, syncope. And remember, hyperkalemia could progress to lethal dysrhythmias like ventricular fibrillation. So option 2 is true. More assessment is needed in this situation. There is not enough information in the stem to take action. The EKG changes that could be associated with hyperkalemia could be peak T waves, a wide QRS complex, and maybe even ST segment depression. So since cardiac muscles can't tolerate those sudden spike in potassium levels, we need to initiate continuous cardiac monitoring for early detection and treatment. Emergency treatment for hyperkalemia is essential. Time is hard. Now, looking at options 1, 3, and 4, they're false. Option 1 is false because IV potassium chloride would increase the potassium levels even more and increasing the client's risk for lethal dysrhythmias. It wouldn't be safe to implement. Option 2 is false. Think least invasive to most invasive. There's not enough information here to take any action. There are other less invasive options if the client has healthy kidneys, like sodium bicarb, insulin and dextrose, and loop diuretics like furosemide. Although hemodialysis can regulate electrolytes by functioning like our body's own endogenous renin, angiotensin, aldosterone system and rapidly remove that potassium from the body, it is not indicated. We reserve dialysis for clients with renal failure, typically stage 4 to 5, and who are showing signs of fluid volume overload or severe hyperkalemia. The value is not listed here, so we can't make that assumption, and we never add to the clinical scenario presented in the STEM. Now, Nurse Samantha did an awesome job talking about chronic kidney disease, so make sure to check that out. And then option 3, the glucose levels are not affected by tumor lysis syndrome or hyperkalemia. However, this would be indicated if we were treating hyperkalemia with insulin and dextrose. Remember, insulin is going to push that potassium into the cell, and an adverse effect of insulin is hypoglycemia, which is not mentioned in this scenario, so this option would not be correct. Awesome job. Moving on. All right, the nurse is observing a staff member perform a central venous access device stressing change. The nurse should intervene if the staff member is observed. Option 1, cleansing the insertion site with alcohol for 10 seconds using friction. Option 2, allowing the insertion site to air dry completely before applying the new dressing. Option 3, placing a surgical mask on the client and applying clean gloves before removing the old dressing. And then option 4, applying a CHG patch over the insertion site and covering it with a sterile, transparent dressing. Alrighty, 30 seconds. You got this. You all have been doing amazing. Keep it up. Keep up the momentum. All righty, awesome job. Remember that abnormal cues is the central venous access device, and there are three main types. You have a centrally inserted catheter, you can have a peripherally inserted catheter, or an implanted port, which we see a lot in patients that need to receive chemotherapy. Now, no matter which way these devices are inserted, they all rest in the distal end of the superior vena cava near the junction of the right atrium. So this places the client at increased risk of local and systemic infections. Now, intervene means the action that is not safe, or there will be a complication if that action is performed. So drop those rationales in the chat and let's get into it. All right, so option one is true, and the nurse should intervene if the staff member was cleansing the insertion site with alcohol for 10 seconds using friction. Because when we are doing a dressing change, we want to use a cleansing solution like chlorhexidine and scrub with friction for typically 30 seconds. Now, chlorhexidine is going to provide longer lasting effects to fight off and eliminate bacteria than alcohol or even providone iodine. Now, this is definitely going to be a skill that you will be practicing over and over again once you get to the bedside. Now, let's look at options 2, 3, and 4. They are all false, as they are necessary interventions to prevent the spread of infection. So when performing a dressing change, the nurse should not intervene if those actions were actually observed. Awesome job. Moving right along. Alrighty, the nurse is planning care for a client who had a mastectomy and has lymphedema of the right upper extremity. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. Option 1, apply a compression sleeve to the client's right upper extremity. Option 2, place a safety alert bracelet on the client's right upper extremity. Option 3, collect blood specimens as necessary from the client's right upper extremity. Option 4, perform passive range of motion exercises of the client's right and left upper extremities. And then option 5, instruct unlicensed assistive personnel to obtain blood pressure readings from the client's left upper extremity. 30 seconds. You all have done so well. Let's finish strong. Let us know what strategies you're currently using to answer these questions and if they're working for you. You can always check out uworldnursing.com, go to our YouTube, TikTok, Instagram for test taking strategies and more practice with NCLEX style questions. Finish strong, last one. You're all doing so amazing. All righty. This is a select all that apply, so we will choose all interventions and options that apply. Remember, we're taking that true or false approach to each option, and we're looking for statements that are safe in this case and appropriate for the condition to include in the plan of care. So those are options 1, 2, 4, and 5. Now, a mastectomy is the surgical removal of breast tissue, and that can include lymph nodes, and it's typically part of the treatment for certain types of breast cancers. With the removal of those lymph nodes, we worry about lymphedema, which happens when we have impaired lymph drainage due to the absence of those lymph nodes. So to lower the risk or exacerbation of lymphedema, we should avoid that extremity at all costs. So no blood pressure checks, no IVs, nothing should be done on that extremity. All right, awesome job. Awesome job. Make sure you sign up for our 7-day free trial. Join us on Tuesday for live lectures and Wednesday and Thursday for more live question drills. Thank you so much for you all joining us today. We really appreciate it, and we look forward to seeing you next